Recording.
Hi, I'm Ed Jacobs, the originator of Impact Therapy, and I'm going to interview or talk with a colleague of mine, Dr. Tori Stone, and I'll let her talk about her use of impact therapy. Tori, tell me a little bit about your history with impact therapy.
Okay. I went to graduate school in Western Pennsylvania, and I saw you at a conference, a 1 hour workshop in '98. And I came to your 3 day workshop, and it was life changing. So I did an internship with a impact therapist in the schools. I'm a school counselor, and I come back every year to do your to work at your 3 day workshop. I teach impact therapy. I've taught classes in impact therapy and creative counseling. I've came and worked with you here at WVU, and I have taught creative counseling at George Mason University as well, and I use it every day in my practice as a school counselor.
How would you describe impact therapy just in your words?
Impact therapy is a creative, multisensory approach to counseling. I like it because it's very hands-on, and it frees you up to do creative things in your counseling.
Yeah, and as a school counselor, I know you and I have talked a lot. How do you use it, and how do you think your counseling is different than maybe the people that you've seen trained more traditionally?
I use it every day. I can't imagine not using impact therapy. In fact, when I do presentations for school counselors, they're often like, this is what I need. When you work in the schools, for instance, my caseload last year was over 600 students. I don't have a lot of time. Instructional time is very valued in the school, so the amount of time that I have with kids, I need to be able to move as quickly as possible in a session, and to be able to have as much impact as possible. So when I'm using multisensory techniques, especially with kids, it's not boring, and they're able to take what we've talked about and keep it with them as they go out into their lives.
When you say you use it every day, what does that mean to you? Like you would use a what? A prop, a whiteboard?
Absolutely. Impact therapy, most importantly, is theory driven. So I'm always thinking, I'm using a multisensory approach, but I'm always thinking theoretically. And so with kids, I might use chairs. I might make them get up. I might stand on my chair. I might have them throwing Play-Doh. I might use dolls. I have hula hoops in my office that I use. I don't work with little kids, and I've used these techniques with people of all ages. But it's just a multisensory way to say, hey, this is what I think is going on in your life. And I find that that works really well with the kids and teachers.
It's safe to say that most, if not nearly all, of your sessions aren't just talk, listen,
Yeah.
and reflection of feeling.
Yeah, depending on what the issue is, but that's not a good fit for me, talking and listening. So a lot of times, maybe it's just, okay, let me see if I have this right. I work in a middle school, so kids are often coming at you with multiple issues, with multiple components. So a lot of times I'll either use a whiteboard or just a piece of paper and say, okay, this is happening, this is happening, this is happening. Where is she to you? Or I have nesting dolls on my desk, and I'll represent the people that they're talking about with the nesting dolls, and then have them interact. So that they can kind of see playing out what's happening in their relationships.
Yeah, one of the things I think about is we talk to the clients' ears and eyes
Right.
as well. I mean, most people talk to their ears, we do their eyes.
I agree, and adolescents are so visual, and they're so used to really multisensory visual stimulus. To sit there, it's just not developmentally appropriate that they're going to sit and listen for very long. That's boring for me, and it's certainly boring for them. So the ability for them, and it's always cool to me when I will set up dolls or whatever, and then they take them and they move them. I have a candy dish in my office. I use lifesavers sometimes to demonstrate what's going on for them, and then, we'll throw the lifesavers, and it's just
There's a concept lifesaver to use that too.
sometimes, yeah, absolutely.
I like that.
But the idea that, one, that the counseling office is someplace where you're going to get help, it's not going to be boring, it's not going to be just a lecture, and that they are going to be in person interacting in what happens to them. My perspective is developmental. I want to give them tools. I'm an educator. Give them tools to take out into the world to help
Let
themselves.
me ask two other questions. One is like the focus on feelings. a lot of emphasis in a lot of programs is to focus on feelings. I don't think you ignore feelings, but do you have any thought? How do you?
I don't focus a tremendous amount on feelings. I think kids spend so much time, particularly the kids I work with, that they're overparented in a lot of regards. So they really know that they feel sad or they feel bad or whatever. But intellectually knowing how you feel isn't the same as changing your life. So we identify the feeling, but then we talk about what is happening in your life that's making you feel this way, and empowering them to make changes that can help them to feel better.
One last one. You said something about moving it fast or something. A lot of people have criticized impact therapy for moving too fast. What are your thoughts about how fast should you move? Should you spend the first 20 minutes building rapport?
I get 20 minutes with a
Well,